Regenerative medicine is using something that's natural, whether it be your own blood or the human cellular tissue product, and helping to improve your body without surgery to kind of regenerate or renew the area where we intended to be done. So when I first meet you, we'll discuss what's given you the biggest problem, kind of the history behind it, how you've been able to cope with it, what you're not able to do with it. We'll probably get some x-rays. Either the chiropractors have done it prior to me seeing the patient, if they're referring them to me, or if they're a new patient to the practice and I'm the first one seeing them, we'll get x-rays to kind of see what's going on and make sure there's no acute issue going on. And then after the x-rays, we'll just discuss the course of treatments, whether that be the trigger point injections, hyaluronic acid, PRP, or human cellular tissue product. And then from there, we'll get you scheduled and get moving. And I've been a nurse practitioner for about 11 years. I've been a nurse for over 20. But before I became a nurse, I wanted to be a physical therapist. So this realm has really come back to my first love of physical therapy, helping people improve.